I am. My name is Alicia, and this presentation is for my Anatomy and Physiology 1 class. In this video, I will be talking about a girl named Brooke Greenberg, who suffers from a rare disease. Brooke was born on January 8, 1993, at the Sinai Hospital in Baltimore, Maryland. She was born 1 month early and only weighed 4 pounds. She was diagnosed with an anterior hip dislocation, which was corrected by surgery. Her right eye also slightly droops. She otherwise appeared to be a normal child. Within the first 6 years of life, she suffered through many medical emergencies. Brooke suffered 7 perforated stomach ulcers. She also suffered from a seizure, which was later diagnosed as a stroke. No permanent damage could be seen. At the age of 5, Brooke was diagnosed with a brain tumor, which caused her to sleep for 14 days. But when she awoke, the brain mass seemed to have disappeared. Her current pediatrician, Dr. Lawrence Pakula, does not understand how that could happen. And also, to ensure that food does not enter her lungs, Brooke is fed through a feeding tube, which takes her family about 10 hours every day to complete. The real mystery behind Brooke Greenberg is that she never grows. She is 16 pounds and only 30 inches long. Brooke is only the size of an infant and has the mental capacity of a toddler. Great doctors from all over the world have tried to diagnose her, but she has never formally been diagnosed with any kind of known genetic syndrome or chromosomal abnormality. When Brooke was young, the doctors always assured her parents that she would catch up to the regular rate, but she never did. Her parents took her to a series of nutritionists and endocrinologists. One endocrinologist suggested that they try a growth hormone treatment. The treatment had no effect on Brooke's body. Not an inch was grown or an ounce gained, and that's when her family knew that she was in trouble. Upon further study, an endocrinologist found that Brooke's body was not growing as a synchronized unit. Some parts of her were more developed than others. For example, Brooke Greenberg's brain is not much more mature than a newborn infant. The doctor estimates her mental age at about 9 months old. She responds to life just as a baby would. She cries when she is upset, she giggles when she sees her family, and she tries to communicate with noises just as a true infant would. Her bones, on the other hand, are like that of a 10-year-old, and she still has her baby teeth, which they estimate at about 6 years old. But her hair and nails grow normally. All of the doctors who have examined her find her very interesting, and they see Brooke as an opportunity to understand the process of aging and possibly how to stop it. Her family sees her as a fountain of youth. Despite her disabilities, Brooke has grown up in what looks like a regular home. Like every other Jewish girl, she had a bat mitzvah when she turned 13. She has a mother and a father and 3 full-grown, fully developed, healthy, active sisters. One of her sisters is younger than her, and she is fully developed. They currently reside in Reisterstown, Maryland. Her family sees her very differently than the doctors do. Her mom talks about how she loves to shop, and her family jokes about how she loves to rebel. She is just like a regular 16-year-old in their eyes. Unfortunately, the doctors don't know how long Brooke will live or if she will develop any more medical emergencies, as she is very fragile. But they continue to study her and hope to find not only how to stop aging, but possibly a cure to cancer. There are a couple more cases in the world just like Brooke, but Brooke is by far the most underdeveloped of those cases. This has concluded my presentation, and thank you for listening.